Ready? What's the date today?
March 5th, is it?
5th? Yep, March 5th. Welcome to DHS. It's March 5th. We got a semi-sunny day here out in Michigan, and it's a beautiful day, especially for the winter. And I wanted to really discuss the elephant in the room right off the bat because I'm kind of tired of this question, and I'm sure a lot of the awake people are, but a lady asked about the coronavirus in America. What do I think about this? Excuse me. I was blessed to have a father with polio. I saw his little right leg, was a little tiny leg, my entire life. It was kind of a gift to see that because I actually never thought about polio. I never thought about giving my kids a polio shot, and a father that had polio, it just didn't seem to register. Then I get into chiropractic school, and I remember in one of my biology or microbiology classes, they talked about polio. They basically said everybody had polio because it was pretty much everywhere, and most people thought it was the flu. Apparently, my father was awful sick, vitamin C deficient, immune compromised, because he couldn't handle the virus that everybody else threw off easily. And after a year of this scrawny little leg issue, it gave him a problem for the rest of his life. Viruses are all around us. Masks do nothing to stop it. We've been surrounded with all kinds of viruses, specifically SARS, Zika, the swine flu. The older folks have lived through this. About every 2 years in an election year, we have to play some kind of a viral game. This body is incredibly strong. I wouldn't think twice about getting something like the flu, because the flu goes around every year. Being this is probably a man-made virus, like many other viruses, it's going to be more tougher on the people that are immune compromised. We talked about a simple spray that somebody asked about. Keep your respiratory tract clean and healthy. Cataplex A and C tablets, you get sick to your nose and to your mouth. Have a healthy respiratory tract. Don't worry about the flu. You're exposed to viruses constantly, and thank goodness that you didn't know about most of them, because you would have been terrified about that. Live your life. Most of you, I would be fair to say, you never knew anybody with the corona, Zika, swine, or those weird viruses. It's just media hype.
You only have a 98% chance of survival anyways. We got a few questions that we're segueing through as far as YouTube, Facebook, and pulling some from my Instagram page as well. Had a patient ask on the Instagram page, if someone is living a chronically unhealthy lifestyle, what would you say is the first baby step that they could take towards becoming more healthy? So there's a lot of people that are unhealthy in our population, as well as a lot of people that think they're healthy and they're pretty unhealthy as well. First and foremost, a high quality food-based multivitamin, essential fatty acid, and during the last bit of the winter time, a good quality D vitamin is essential for everyone. Dr. Tent and I both recommend shakes with patients as a great way of getting a full nourishment. And another patient asking, what do we mix with our nitro greens? I use collagen, I use raw chocolate to kind of help flavor it. Dr. Tent's got a little bit more exotic protocol that you can find on our website with that. A lot of cool things that you could do to help nourish yourself simply, even if you don't have the cleanest lifestyle as far as eating habits goes. So I hope that helps answer your question.
A doctor asked a question. One of our patients just got a lupus diagnosis. What supplements can or should I recommend? Now, when you start watching people who have gone to lots of doctors, the diagnoses get more exotic and extensive. If there was a supplement for lupus, I'm sure it would be extremely popular. It's difficult to see a lot of lupus patients have the same symptoms because it's all so different. Chronic immune breakdown, chronic inflammation, chronic infections. Start looking at the past and see what kind of chronic problems these people are carrying. It's a great place to start because there's no simple, straightforward answer for lupus. Everyone I've ever seen kind of had to be treated differently depending on the background that they brought us. Your body just didn't get lupus one day. There's a lot of things that lead up to that. It's kind of like an end spot rather than a starting point.
Michelle asked about her 2-month-old child being in the hospital and having some health issues, and what kind of immune support she could do for her infant that has underdeveloped lungs. Any organ in the body that's hypo underactive, for instance like a thyroid, there's a glandular thyroid supplements that can help an underactive thyroid. If your adrenals are underactive, we have supplementation protocols specific for underactive adrenals. Same thing with underdeveloped lungs. If you use the PMG protomorphogen form of the lungs, that's a starting point for an underdeveloped lung situation in an infant that helps support their immune system. Thanks for your question.
Irene asked, how do you use your polarizer? You really want to know? 10 days ago at hockey, I took the worst hit from behind I've ever had and dislocated my collarbone where it meets my sternum. Stem cell, Ligaplex 1, that polarizer has been basically stuck on that thing. I was able to go to work in about 2 days. It happened Saturday night. I've been adjusting with the sorest collarbone you could possibly have, and to see how much that polarizer can reduce the time of inflammation. The hotter the injury, the faster it works. There's no end to what you can use the polarizer for. The more toxic things that you polarize, the more they'll change. The more natural things that you find normally in nature, the less they change. Let your imagination run wild. There's no end to what you can do with the polarizers. We don't sell them here. They last forever. The patients are having an absolute blast with them. And I've used it on every hockey injury I've ever had. And it's really helping stabilize that collarbone because I got to use my arms at work every day. Enjoy your polarizers.
Jennifer asks, what can you do to help middle-aged women going through menopause crank up their metabolism? A lot of things I like to look at. There's a pretty cool saliva test, one-day hormone test that looks at the estrogen issues. It looks at the cortisol, which contributes to a lot of the weight issues that I see with patients, and the stress factor that goes along with that. I like to look at the gut and the food sensitivities. So there's a collaboration of things that I put together to kind of help work with the metabolism of postmenopausal women. Thanks for your question.
With the way things are going right now, the lecture that I'm going to put on April Fool's Day, April 1st, cognoscopy, I've never seen such levels of anxiety in the public right now. And people ask questions about anxiety. The public's getting amped up in a lot of different ways, from politics to 5G to the food to the medications to our educational system. Seems not designed to fail. So you don't want to miss the lecture on cognoscopy. I'm going to help a lot of people gain traction mentally that are losing ground right now, because I've never seen kids losing ground like I have lately. The depression and anxiety is out of control. So stay tuned for that lecture in April, because it's going to be right up everybody's alley, because I'm going to touch everybody's life, because everybody's got this in their family. It's going to make it a lot easier to deal with you and your family.
Kay and Jessica had a similar question. Kay wanted a natural approach for pink eye, and Jessica was wondering about what she could travel with on a plane, spray-wise, to kind of help prevent illness. The Care Spray is great. The colloidal silver is a little bit more of a lower ounce bottle that you may be able to travel with. And as far as spraying it goes, pink eye, you can do the silver in the eye and the throat, no problem. And it should be a bit easier to travel with that one as well. Thanks for your question.
Somebody asked about a natural approach for pain. Well, if you watch on our website today, I did an Instagram of a young man that came in with such side pain. He took 4 Advil every 6 hours for 2.5 days. Now do the math on that. He had such a liver ache in those 2.5 days. Some people can't process this and some people can. He couldn't. Be very careful with the pain pills that are out there today, because if you get clipped by Advil or ibuprofen or Tylenol and you're very sensitive, your numbers can get out of range so quickly you will not believe what you'll see on a blood test. The highest liver enzymes I've ever seen was 28,000 after a month of Tylenol by a young teenage kid. That required hospitalization to detoxify the liver. I saw one of the most toxic livers I've seen in a long time on 2.5 days of ibuprofen. Be careful. Remember, I used the polarizer as the first thing on my injury, amongst other things, but you don't want to get tangled up in that.
Aaron had a question. What, if anything, can folks do to better handle the clock changing this weekend? One of my favorite things that I personally use is the simple melatonin stuff. I used to do midnight shifts and switch back and forth between afternoon shifts and kind of help reset my sleep cycle. Now, especially going into this weekend, go to bed a little earlier and use a little bit of melatonin supplementation should be pretty beneficial for most people. Good question, Aaron.
Terry just asked, I haven't had the flu for 2 years, but I get migraines in the morning. Well, maybe there's something in your head that's causing those migraines in the morning that might be a different application of the flu. People carry viruses a lot of different ways that they're not aware of, from unusual lymph swelling to weird bone marrow elevations to weird cyclic headaches to weird strange body fevers. There's so many different ways viruses manifest themselves. You'll see a very special brain virus story at the next lecture. You don't want to miss that. It's going to be special.
Paul asked a question. Any carpal tunnel advice would be appreciated. The carpal tunnel is a pain in the hand. That may be an issue with a neck adjustment, with your neck being out of place. It could be the real carpal tunnel with the medial nerve being inflamed. So chiropractic-wise, that's something that we like to adjust within the office. If it's inflammation within that medial nerve, we'll typically start with B6 supplementation. Thanks for your question.
Well, folks, I have to get back to work, and I've enjoyed this time with you. I appreciate all the questions. We'll be back here soon.
Do you want to take a few YouTube ones?
Go ahead, answer the question from Carney. Do you have children for your multivitamin for children? And what do you recommend for influenza A?
So, my children, the Callen's very easy to get down. You could crush it, they could chew it up. The whole food standard process, multivitamin Callen works very easy to get that down to children. What do you recommend for influenza A? Prevention-wise, vitamin D. Vitamin D, vitamin C, vitamin A are all strong antivirals. All good quality supplementation through biotic or standard process. Good quality supplementation, and not letting your immune system get run down. Should be pretty beneficial for most.
Hopefully you're enjoying the energy lecture and Dr. Jeff's latest lecture. They're all out there. We look forward to seeing you at the cognoscopy lecture at Sheraton, April 1st. See you then.
Hang on. We look forward to driving a little bit more of our YouTube channel, the paid subscription one, because us being monitored more on Facebook and other social media outlets, that we're really going to drive and push forward more of the YouTube stuff. So we look forward to getting your feedback of what you want Dr. Ted and I, what you want to hear from us. So leave your feedback and comments for us. Thank you.
Done?